My name is Okechukwu Ironkwe. I'm looking at situation analysis of private medical laboratories in Nigeria. The underlying rationale and philosophy of this study is that private medical laboratory are essential components of healthcare system in Nigeria. Considering the dwindling economy and recession, private medical laboratories were worst hit. However, at the same time, this component of health system is also expected to deliver quality services, laboratory services to Nigerians. Um, um, they have also tried to drive the sector through a transformative process, trying to identify opportunities, encourage job creation, increase productivity, and they are also looking forward to becoming a stimulant to economic growth. However, we had noted the wide gap in standard of accreditation status when compared to other multinationals, countries like South Africa that have well over 276 internationally accredited laboratory according to WHO data, while in Nigeria we have just three private laboratories that have met international accreditation. And of course, this data is quite worrisome, and it is obvious that laboratories in South Africa are doing quite well as compared to laboratories in Nigeria. And according to statistics, this has been attributed to poor infrastructure, power, inadequate basic and amenities, unfriendly government policies, which has bedeviled this very important component of healthcare in Nigeria. However, the Federal Ministry of Health, through the Medical Laboratory Science Council, have seen the need for regulation and good standard practice by all laboratories in Nigeria with a view to promote health and a productive society. In order to function effectively, all medical laboratories need strong support system through instruments such as private medical laboratory service policy and plan, which of course none is on ground yet. But I want to hope that this study would provide the platform for a policy and a plan for private medical laboratories in Nigeria. Such policy may never be achieved without first ascertaining the true state of private laboratories in Nigeria, bearing in mind that such study will provide vital information needed for proper planning and utilization of limited allocated resources. It further creates a link between clinicians, laboratory proprietors, regulatory agencies, financial institutions, equipment and reagent dealers, and of course the patients. The objective of the study was to collect and collate quantitatively and qualitatively data on the current status of private medical laboratories services in Nigeria. Specific objectives: to determine the status of the current private medical laboratory services, to determine the input required to improve services to optimum standard, to prioritize strategies for improving private medical laboratory services, to provide a baseline for monitoring and evaluating the implementation of a national private medical laboratory policy. Based on categorization of laboratories, here in Nigeria, private laboratories can be categorized as mono, multipurpose, and we have the uncategorized based on what we got on the field. However, the Medical Laboratory Science Council of Nigeria, which is the regulatory body, requires that these laboratories be
Here,
categorized. And of course, we
excuse
have
me,
10% of mono labs.
you have
Mono
only
labs
2 to
means
3 more minutes.
they are
You please
accredited
utilize
or
it
they
properly.
are certified
You have
to
only 2
carry
to 3
out
more minutes.
specific tests. Yes. Okay. All right. Um. Okay. We also looked at laboratory managers and their qualification, and that is shown on the table there. We looked at equipment requirements, and of course, it's obvious that monolabs had more equipment because they had little, the number of tests required to be carried out in monolabs, of course, cannot be compared to that of multipurpose labs. So we also have looked at percentage of private medical laboratories adhering to minimum approved test profile, and that result is not quite good. The uncategorized laboratories, of course, do not adhere to minimum approved test profiles, while also the multipurpose laboratories, just 13% adhere to approved test profile by the Medical Laboratory Science Council of Nigeria. Percentage of laboratory adhering to procurement system supply is also on that table. And we also have percentage of frequency of laboratories with storage systems that can also be seen on that table there. And of course, in semi-urban areas and urban areas, you can see that they have been able to show that storage systems are better off than as compared to rural areas, and of course that can be attributed to infrastructure. And the next table, you can also look at it for infrastructure. The surprising thing is that most of the laboratories in Nigeria tend to establish their structures in rural areas, and that can be explained because of the amount you have to pay for rent in urban areas. You find that most of them uh, rather go to rural areas to establish private laboratories. And for electricity, of course, urban areas, semi-urban areas have more electricity. Running water, the same thing. Then SOP, standard operating procedures. You see that laboratories in urban centers are better off and adhere to SOPs. External quality assurance, although very few labs are participating, and most of those labs are in urban centers. And safe water disposal system. Yeah, we also have that most of the labs are deficient in safe disposal of waste, and quite a high percentage of these laboratories do not dispose their waste appropriately. Percentage of staff training is quite poor, and we realize that the findings of this research is rather worrisome and cast aspersion on the quality of laboratory services in Nigeria. The need to get out of the wood should be paramount, but quality requires quality standard equipment, skilled, competent human resources, quality standard operating system in place, continuous availability of supplies and good safety standards should be in place. The results from this assessment indicate that there is an urgent need to strengthen regulation by the Medical Laboratory Science Council of Nigeria, while also mobilizing resources to raise
Dear
the
Mr.
standard of
Iron,
laboratory services
dear
and
Mr. Iron,
training to meet international standards and
dear
basic
Mr. Iron,
minimum national
excuse me,
acceptable level.
uh,
There is need, there should be need,
dear
there
Mr.
should be
Iron,
concerted
you
effort by
please
government
conclude the
and
presentation.
corporate partners on the need to achieve the goal of improving private medical laboratory services. Yes, I would like to conclude by recommending all. I would like to conclude by recommending that all private laboratories meet requirements and set criteria for operation and personnel training. pers- Personnel training should be given express attention, and also government and other corporate investors should collaborate with private laboratory owners in training skills and competent laboratory personnel through entrepreneurship training. The standards for specification and guidelines for equipment handling should be implemented with a view to ensuring that equipment are standardized for easy use, maintenance, and repairs of laboratory
Thank you
equipment.
so much, Mr.
Policy
Iron.
meetings